Good evening. I would like to call to order the special meeting of the Newport News School Board for Monday, July 20th, 2020. On behalf of the members of the school board and the superintendent, I welcome each of you watching. A quorum is present to transact the business of the school division. The COVID-19 pandemic has had an unprecedented effect on all of us. With the closure of schools and businesses, our daily lives have changed. We are all adapting to this temporary new way of life, and the board is adapting as well. We are implementing new procedures for our meetings. This evening, we are holding an electronic meeting to transact the business of the school board. In doing so, we are practicing social distancing in cooperation with the governor's orders. We are taking these steps to ensure the health and well-being of our staff, students, and the public. We would prefer to conduct our meetings face-to-face with an audience, but like so many of you, we understand the importance of doing all that we can to flatten the curve of the coronavirus. Tonight, I am in the school administration building auditorium, and I'm joined by the superintendent, the deputy city attorney, the school board clerk, and 3 staff members. School board members are connected virtually, and the public will be able to see and hear them as we review and discuss the business of the school division. As advertised, citizens may submit comments via web form, email, or voicemail up to 30 minutes prior to our meeting time to be included in the official meeting record. All comments will be provided to the school board. We are committed to conducting our meetings in an open manner, and we will make every effort to ensure public input. We value and appreciate your partnership. We will begin tonight's meeting with the Pledge of Allegiance. Mr. Hunter, would you please lead us out?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Hunter. And now that moves us to item 2, reports and information. We have one sizable report on the agenda tonight, which is our Return to Learn reopening plan. And Dr. Parker, I believe that you have some slides to present to us this evening.
Yes, and good evening, Chairman Brown, Vice Chair Searles Law, and our board members, and a special good evening to our newest board member, Mrs. Amon, and Mr. Jordan Moody. Thank you for joining us this afternoon. I'm sorry, I'm muted. I'm going to have to do that all over again. Good evening, Mr. Chairman Brown, Vice Chair Searles Law, and board members. I want to say congratulations and welcome to Mrs. Rebecca Amon, our newest board member, and Mr. Jordan Moody. Thank you for joining us this evening. Mr. Chairman, tonight's presentation is a detailed presentation for the board and our staff and community on our plans for opening school in the fall. We will begin this presentation with some of the guidelines either set by the governor's emergency order, as well as the Center for Disease Control and Virginia Health Department. Then we will share the structure of the proposed plan, which will include 3 unique options for the start of school in September. Once my staff have presented the plan in detail, I will then close out the presentation by sharing our recommendations for next steps moving forward, which will ensure that our transition into the start of the school year begins with an effective plan for ensuring both the safety of our staff and students, while also allowing for quality teaching and learning to take place in all of our schools. On March 13th, 2020, and next slide, please. There you go. On March 13th, 2020, as part of Governor Ralph Northam's response to the rising spread of the COVID-19 virus, schools were closed for the remainder of the 2019-20 school year. Since that time, the governor has introduced 3 unique phases up to his emergency order, which have impacted how our schools may operate. Each phase specifically determines how many persons may safely occupy a shared space, how close individuals may stand apart, whether protective coverings such as face masks are optional or mandatory, and whether certain facilities may be open or the kind of activities we may engage in safely. The governor's phased standards have been aligned in most part with the safety guidance set by the Center for Disease Control, which has provided further guidance on combating the spread of COVID-19 through things like hand washing, health screening, self-quarantining, and sanitizing of spaces. On July 1, 2020, Governor Ralph Northam declared that the majority of the Commonwealth of Virginia would transition into phase 3 restrictions under his emergency order. To provide the necessary educational guidelines for developing local plans for returning to school, earlier this month, the Virginia Department of Education released the Recover, Redesign, and Restart Plan for 2020. While this one slide does not give full context to the over 100 pages of the plan, what is important to note in the VDOE's plan are the clear guidelines associated with what schools may look like under each of the phases of the governor's emergency order. For instance, under all phases of the state guidelines, mitigation of safety standards includes such things as maintaining 6-foot distance, hand washing, and the wearing of face coverings are encouraged. What changes between the phases is the extent to which students or staff may interact. In phase 1 of the governor's emergency order and the state plan for returning to school, that is the most restrictive of the 3 phases. The predominant mode of instruction for all students is virtual learning. Schools may elect to provide some in-person instruction for students with disabilities under phase 1 with proper physical distancing. As we move into phase 2 of the Return to Learn plan, there are allowances for more students to meet in a classroom environment, beginning with our most vulnerable populations of students. Those students would be our special needs students, English language learners, and early learners in grades pre-K through 3. So under phase 2, those students would have an option to meet in person to provide the most direct instruction for those special populations of students. All other students under phase 2 would be in virtual learning. In phase 3 of the state's Return to Learn plan, that is the phase that we are currently in. The governor's emergency order, as I mentioned, we entered on July 1st. So under phase 3, under that phase, we are currently able to allow face-to-face instruction for all of our students while maintaining the boundaries of social distancing and all the other safety precautions. Beyond phase 3 would be what we would consider our new normal. At some point, we hopefully will move beyond a phase 3 condition, and we will be able to return all of our students to school and determine what those safety precautions will be as we continue to fully enroll our students into face-to-face instruction. It is most important to note that the Virginia Department of Education established the Recover, Redesign, and Restart Plan for 2020 as a guide for local school divisions to establish instructional plans for the return of students in the fall. School divisions are permitted the flexibility of establishing fall plans which best meet the unique needs of their community and students. However, we are advised to work within the boundaries of the guidelines set by the Center for Disease Control, Virginia Health Department, and our governor's office to ensure the safety of our staff and students. So, Mr. Chairman, as we present our plan this evening, we are confident that we will be able to meet the expected standards for safety under each of the plan proposals being presented this evening. As we present the Newport News Public School Return to Learn options for the fall, it is important that we begin by reminding all of our participants who are viewing it in this evening that we all want a safe environment where all students may be able to learn, work, and grow. We also want our staff to be safe and be able to succeed in our primary mission, which is to provide a quality educational experience for all students in our every day of class. That said, how we reach our objectives require that we not only manage the potential for the spread of the virus once school is in session, but also we must have the right instructional program in place to ensure that our students are receiving the proper service. To prepare for the start of the 2021 school year, a Return to Learn committee was established in late spring of this year to begin a look at the many variables associated with successfully returning to school in the fall. This evening's presentation is a culmination of that work. That plan is presented this evening. We'll present the product of our lessons learned from last spring when our school year was abruptly ended, and we'll also will reflect the input that we've received from our stakeholders that we received from our initial planning survey, which was handed out at the end of June. As our planning developed, input on our safety and instructional planning was shared through smaller group meetings with advisory groups, principals, and extended collaboration at both the state and regional levels. Through this process, we were able to share best practices with other school divisions from around the state and discuss potential problems together. This collaboration also allowed us to determine that a stronger commitment to virtual learning, online learning was needed in our plan, as well as an effective plan for ensuring safety of our students and staff on a daily basis. So tonight we'll present a plan that reflects that preliminary work to the staff and to the community and to our school board for consideration, and we hope that it meets your expectations. The final slide I have here tonight is a little bit about the survey that was administered. On June 25th, we launched the initial planning and input survey. We invited input from parents, students, and staff to respond to questions related to preferred instructional options, their comfort levels with returning to on-site classes, bus transportation, and issues related to childcare. The survey garnered the highest participation rate of any survey administered over several years. In all, we received over 13,000 responses to the survey, which included over 7,900 responses from parents, 2,100 responses from students, and 29,000 responses from staff. It is also important to note that the survey was distributed in both English and Spanish. As my colleagues present the overview of our proposed plan this evening, they will share more information about the survey data and how it guided the development of our plan. Dr. Jones, the Executive Director of Curriculum and Development, will now begin the review of the proposed instructional models for each option as proposed under our Return to Learn plan for the fall. Dr. Jones?
Good evening. The first portion of the plan highlights teaching and learning. I'd first like to thank all the teachers, administrators, and support staff for all the work provided to our students and families due to the closing on March 13th. Staff spent endless hours communicating through Zoom, posting assignments, reaching out to families, and learning how to provide instruction virtually by engaging in numerous professional development sessions. As we plan all three phases, we have gained insight and lessons learned from many of our stakeholders in the event that we are required to move to phase 2 or to phase 1. Our supervisors, specialists, and lead teachers have currently reviewed the curriculum to include standards that were not taught or mastered during the 4th marking period. This revision also includes the incorporation of blended learning practices and instruction in Canvas, our learning management system. As we move forward with presenting our proposed plan, Newport News Public Schools is prepared to engage our students, staff, parents, and community to the greatest extent possible by maintaining safety for all. I would like to begin with sharing our survey data. What is your preferred method of learning for your children? That was the question that we asked. We surveyed staff, parents, and students. As you can see from the data, the hybrid model at the time of the survey yielded 61% for staff, 56.2% for parents, and 61.8% for students, while the virtual model yielded 26% for staff, 36% for parents, and 26.4% for students. Unsure, 12% for staff, 7% for parents, and 11% for students. This data was used to help develop the plan that we will share with you tonight. I will present to you two models, the hybrid learning and the virtual learning models. I'll begin with the hybrid model. Students participating in the hybrid model will engage in 2 days of in-person instruction at school. Classes will be smaller due to physical distancing guidelines, and they will also participate in 2 days of at-home learning and 1 day of asynchronous or independent learning. On the 2 alternating days of at-home learning, students will receive some degree of support. At the elementary level, guided instruction will be provided in English and math by a teacher, support staff, or through recorded lessons. At the secondary levels, guided check-ins will be scheduled on at least 1 day of at-home learning. On Wednesdays, all students will participate in asynchronous learning, completing independent assignments, projects, and working on computer-based programs such as Dreambox, iExcel, or NoRed Ink. However, on Wednesdays, teachers may also engage some students in small group instruction, as well as participate in professional development, hold office hours, or attend staff meetings. Wednesday will also be used as one of our cleaning days, and I'll talk about that in just a moment. Students participating in the hybrid model will attend school on Monday, Tuesday, or Thursday, Friday. The two consecutive day model of instruction was selected to minimize the mixing of student groups. On Monday and Tuesday, students in Group 1 will receive in-person instruction at school, while Group 2 is participating in at-home virtual learning. On Thursday and Friday, students in Group 2 will receive in-person instruction at school, while Group 1 is participating in at-home virtual learning. Building occupancy will be limited on Wednesdays to allow time for deep cleaning after Group 1 and again on Saturday after Group 2. Also on Wednesdays, as mentioned previously, teachers will engage in professional development, hold small group instruction for identified students, and attend staff meetings. Next, I would like to talk about the virtual learning model. Students participating in the virtual learning model will engage of 4 days virtual instruction with teachers and 1 day of asynchronous independent learning. Students will participate in approximately 2.0 to 3.5 hours of live virtual instruction daily, depending upon the grade level. Although students are not participating in live instruction for the entire school day, they will have assignments to complete independently. Class sizes will be larger due to the fact that we don't have to maintain CDC guidelines. And looking at the virtual schedule, students will participate in virtual learning 4 days, Monday, Tuesday, and Thursday, Friday, and of course, 1 day of asynchronous independent learning on Wednesday. This provides teachers with the opportunity to engage in professional development and staff meetings on the virtual days as well. What do the hybrid and virtual models have in common? Wednesday is an asynchronous or independent day of learning for all students. Instruction will be facilitated by teachers in the Canvas Learning Management System. Students will engage in Canvas to complete and submit assignments. Teachers provide student feedback on and/or post grades weekly. And teachers plan engaged, differentiated, and innovative instructional lessons where students will have voice and choice in learning. As we look at the development of the plan, we also want to make sure that we're supporting all of our learners. The Gifted Services Department will continue to provide gifted services whether students are on the virtual or the hybrid models. This will also include the Governor School of Science and Technology, who will participate in virtual and in-person instruction, as well as participate in virtual mentorships. Our English learners will also receive accommodations according to their support plans. Newcomers will be provided in-person instruction to the maximum extent possible, and the English language development participants will also participate in small group and whole group classes, as well as participate in academic and collaborative classes. One of the goals of Newport News Public Schools is to support students through social and emotional teaching and learning. Students were asked their level of agreement with this statement. There is at least one adult at my school I feel comfortable contacting if I need to talk about my feelings, even when we are learning from home. As you can see from the survey data, 57% of the students felt very comfortable contacting a staff member at school, 20.8% disagreed, and 21% responded as neutral. This informs our staff to engage in work that promotes communication, collaboration, and building relationships with our students. Newport News has established several social and emotional supports for students and staff, such as establishing a dedicated instructional time, access to online resources, training on social and emotional instruction, and the use of toolkits that provide direct and virtual instruction. Additionally, families may also receive support through online services, home-based activities, and ongoing direct and virtual support. Our students with disabilities will receive in-person and distance learning during phase 1, 2, and 3 to the greatest extent possible, with specialized instruction and related services provided according to the student's individualized education plan to ensure equitable access and FAPE. Special education and general education teachers will continue to collaborate to provide instruction and support to students with disabilities based on their IEPs. Ongoing support and collaboration with families will continue through the IEP process, eligibility determination, and the reevaluation process. At this time, Mr. Chris Jenkins will talk to you about blended learning and how we will support our learning plan.
Good afternoon, everyone. As we look at the learning models that were presented by Dr. Jones, each option relies on several tools and resources that will be needed to ensure the success of our students, teachers, and families. So I'm going to spend just a few minutes talking about the supports that we will provide. Each of the models involves elements of face-to-face instruction, online learning, and independent study. This approach, called blended learning, is not something that is new to most of our teachers. Over the past several years, NNPS has invested heavily in building the capacity of our educators to teach in a blended learning environment. Our digital transformation initiative, which began well before the pandemic, places a great deal of emphasis on providing professional learning opportunities for our teachers around blended learning and technology integration. So what is blended learning? On the left of this diagram, you have digital learning, which usually takes place online and allows the student at least some control over how and when they learn. On the right, you have traditional learning, which usually takes place in a school building and is directly supervised by a teacher. A blended learning approach marries the best of these two modes of learning together to provide students with an engaging learning experience that offers at least some level of voice and choice. Before students can participate in blended learning and virtual learning, they must have access to a computer, the internet, and online content. Additionally, teachers must be provided with opportunities for relevant professional learning, which I'll talk more about in just a moment. To support blended learning, NNPS has accelerated our digital transformation plans and purchased enough Chromebooks so that every student in grades K through 12 can have a device. Chromebooks are a familiar platform to NNPS students as they are currently used in all grade levels and content areas. With school districts around the globe transitioning to online learning in response to the pandemic, the demand for student computers has never been higher. At the same time, supply chain problems in the spring made it even more difficult for computer manufacturers to keep up with demand. As a result, some of the devices we've purchased may not arrive in our schools until December. Devices for secondary school students will be available for distribution at the beginning of the school year. Chromebooks for elementary school students will be ready for distribution in December, but in the interim, loaner devices will be made available for checkout for elementary school students who don't have access to a computer at home. Because NNPS is committed to ensuring that every student can participate in online learning, both on and off campus, we are launching our Connected at Home program. Data from the state and the city indicates that approximately 20% of families in Newport News may not have reliable access to the internet. Our own experiences following the COVID-19 closures confirm those estimates. With that in mind, NNPS will provide mobile Wi-Fi hotspots to eligible students who might not otherwise have reliable access to the internet. The hotspots, which will be provided at no cost to eligible families, will empower students to access learning anywhere and anytime. And to keep our students safe online, the same stringent content filtering will be applied regardless of how or where the student connects to the internet. Families not meeting the eligibility requirements for no-cost internet will still receive assistance from NNPS in applying for low-cost internet solutions through this program. We will be sharing more information with our families in the coming weeks and will begin accepting applications for this program in early August. You've heard several references to the Canvas Learning Management System this afternoon and might be wondering how it will help our teachers and students succeed in a blended learning environment. The primary role of an LMS is to organize everything in one location. By standardizing on a single system for learning management, NNPS can ensure that all teachers, students, and families can easily access all of the information they need in order to be successful. An LMS will allow teachers to deliver virtual instruction using learning resources and integrated assignments in one organized space. It will allow them to track progress and usage in a course, annotate and grade assignments, and manage due dates. It will also allow them to facilitate collaboration and communication with enrolled students and teammates. For students, the LMS will allow them to connect and communicate with teachers in their assigned courses. It will allow them to submit work in a variety of ways, and it will allow them to access organized course materials and easily keep track of assignments and due dates across multiple platforms. The Return to Learn survey asked staff members to choose 3 important professional development topics as we approach September and the beginning of school. Among most frequently listed were best practices for online teaching, training in the new learning management system, Canvas, and technology integration concepts. Through a collaborative effort between several departments, NNPS developed a professional learning plan with the goal of preparing our educators to teach in a blended learning environment. In 2019, NNPS launched a 6-week professional learning course centered around incorporating student voice and choice and the principles of teaching in a blended learning format. Over 77 NNPS educators completed this course, called PLOT, during the 2019-2020 school year, and a cohort of 50 teachers are currently participating in the course and will complete it by August. Because our digital transformation relies heavily on the new Canvas LMS, we began providing learning opportunities for teachers in June and have numerous development sessions throughout July and August. Lastly, the Ignite Summer Learning Program features a number of courses designed to help teachers leverage technology to create rich and engaging learning experiences for their students. And Mr. Brown, at this point, we're going to take a break and before we go into the operations and safety segment, and allow board members a few moments to ask questions about the instructional plan.
Thank you. Are there any questions? Yes, Dr. Best.
Yes, my question is for Dr. Jones. And Dr. Jones, could you tell me again the actual number of hours, the hours of actual instruction under the virtual option?
Students will spend between 2.0 and 3.0 hours depending on their grade level. That is not their total hours of instruction. This will just be live instruction.
And that's ranging from elementary through high school, 2.2 to 3 hours?
Yes, 2.0 to 3.5 hours.
3.5.
This is live instruction. Students will continue to work independently to complete assignments that their teachers have provided for them, or participate in online programs. This is just live instruction to give the students a break from being in front of the screen to work on projects and other assignments.
Thank you. Thank you.
Thank you. Other questions? All right, there being none, please continue.
We are handing off to Mrs. Rousseau. Mrs. Rousseau, are you joining us? Are you here?
I am. I'm ready,
All
Dr.
right.
Parker. Good evening, Mr. Brown, members of the board. I'm going to talk to you a little bit about what we've done to get ready from an operations and safety standpoint. As we start our discussion of the safety measures that we're taking to prepare for reopening school, we thought it would be helpful to provide you with the data that we review each day from the Virginia Department of Health. This chart shows confirmed and probable cases in the eastern region of Virginia from February through mid-July. As you know, recently we've seen an uptick in cases in our area, as have many other locations across our country. We'll continue to watch this data to inform our planning as we move forward. You've heard about some of the survey data that was used to drive our instructional plans, and we've also collected some data to inform our operations planning. We asked parents how comfortable they would be in sending their student back to school, knowing that we'd be doing all the necessary things to keep them safe while they were with us. You can see that close to 47% of the parents that responded were either somewhat uncomfortable or very uncomfortable with their child returning to school. We also asked staff what their primary challenges were, and nearly 66% indicated their personal health was a concern, while over 63% indicated that the health of a family member was also a concern. The school division has been working hard to determine what measures are needed to be taken to align our operations with the health and safety guidelines put out by the CDC, the Virginia Department of Health, and VDOE to make sure that we have a safe environment for students and staff when they return. No matter what phase of reopening the state is in when we reopen schools, we've addressed the items that you see listed here. Daily health screenings for both students and staff, physical distancing on buses and in classrooms, social distancing, not mixing groups of students except when necessary, restricting the use of communal spaces, our gyms, cafeterias, and auditoriums, reducing the size of gatherings, whether we return for in-person instruction or in virtual learning mode, cleaning and disinfecting, and use of face coverings and many other mitigation strategies. And we're going to talk briefly about each of these with you this evening. Starting with daily health screenings, we'll be asking parents to take their child's temperature each morning. If they have a fever, they need to stay home. They need to look for parents will need to look for other COVID-19 symptoms as well: shortness of breath, coughing, sore throat, congestion. We'll be providing parents with a questionnaire that lists all the symptoms they need to check for. We also want parents to keep children home who have been exposed to someone with COVID-19 in the past 14 days. For staff, we'll ask them to self-check also for the same symptoms. If they have any of the symptoms, we're asking that they also stay home. The health screening questionnaire that we'll be using was provided by the Virginia Association of School Nurses for use across the state. Regarding face coverings, we're requiring students and drivers to wear face masks while on a school bus. We'll expect students and staff to wear face coverings when they are not able to adhere to the social distancing guidelines of 6 feet. We're going to ask staff to provide and wear a face covering when visiting or working in our schools. We will include face coverings on our students' material list for the fall. We will also maintain a supply for students and staff should procuring a face covering become an issue. Our back to school efforts will encourage community churches, nonprofit organizations, and businesses to support our efforts to build a stockpile of face coverings for staff and student use. Regarding personal protective equipment for our staff beyond face coverings, we'll provide gloves, face shields, gowns, and other protective equipment where the work requires it to be safe. Moving next to transportation, As part of our survey, we asked parents how their students would get to school when we reopen, and the results are shown here. You can see that over 40% would prefer that their students ride the school bus. Physical distancing is important, and on a school bus, the CDC guidance is that we put one student on every other seat in the bus, alternating side to side. That would mean we'd only be able to get 13 to 14 students on a bus, and that really won't get everyone to school. But by requiring students to wear a face covering while on the bus, we'll be able to seat one student on each seat in the bus. Siblings will be allowed to sit on the same seat. This will increase the capacity of our buses to between 20 and 30 students at a time. Students will load from the back to the front of the bus, and they'll exit the bus from the front to the back. Our drivers will clean and sanitize the bus following each route. Physical distancing is also important in our classrooms. We'll be setting the classrooms up so that students will be seated 6 feet apart. While working at their desk, the teacher may allow students to remove their face covering. We know that the World Health Organization and the American Academy of Pediatrics have recommended a 3-foot distance is appropriate as long as students wear a face covering. But we're planning to set our classrooms up on a 6-foot distancing model to give teachers some flexibility with regard to an all-day requirement for face coverings. When moving around the building to the restroom or changing classes, etc., everyone will need to use a face covering. You can see a depiction of a typical elementary classroom and secondary classroom shown here. You can see that we'll only be able to accommodate 12 students in the typical elementary classroom and 16 in the typical secondary classroom. In order to make this work, we will have to move some furniture from the classroom. Meal service is an important part of every school day for our students. We have planned to accommodate students no matter which choice their family makes for returning to school. First, for the hybrid learning option, we'll provide breakfast and lunch in the classroom for our elementary and middle school students. These students already eat breakfast in the classroom, so we have a model to follow. While we think lunch will be a little more challenging, our child nutrition staff is working hard to be able to give students a choice of meals for lunch. At the high school level, we'll use portable serving lines or kiosks positioned in several locations around the building to reduce the congregating of students as they pick up their meal and return to their classrooms to eat. We'll work with the school-based staff to stagger the serving times to further reduce the number of students in the hallways at one time. For the students that attend school on Monday and Tuesday, they'll be given a meal bag as they leave school on Tuesday, which will have 3 breakfast snacks and 3 lunches. The students that attend Thursday and Friday will get their meal bag as they leave on Friday. For students whose families choose the virtual learning option, they'll be able to pick up meals on Wednesday at any school. They'll get 5 breakfast snacks and 5 lunches. NMPS's cleaning schedules and practices comply with the CDC and VDH guidelines for cleaning and disinfecting public facilities. We'll clean and sanitize each building throughout the day. We'll deep clean and disinfect twice each week on Wednesday and Saturday. Much of the CDC guidance suggests that we keep cohorts of students together. So that was our thinking when we set our hybrid learning model up, to have students come to school on 2 consecutive days. Then between cohorts on Wednesday and Saturday, our custodial staff will deep clean and disinfect our buildings. We'll be providing sanitation stations at each main entrance to each NMPS school and support building. We'll have hand sanitizer and disinfectant wipes at each station for use by everyone as they enter the building. We will also have hand sanitizer and disinfectant wipes in the main office of each school. And we have already provided sneeze guards to each main office to provide a barrier for staff that will be interacting with the public when social distancing may not be possible. Looking at the other mitigation strategies that we've considered to put in place, we will be providing students and their families with information on how to stop the spread of this virus. Parents need to know how important their role is in screening their child each day. We'll be trying to limit the movement of students while in school and managing the movement when that is necessary. For example, students moving in the same direction on each side of the hallway when they're moving from classes. Water fountains and lockers will not be available for use. Communal spaces, cafeterias, gyms, and auditoriums will not be available for large group use, but we may be able to use those as smaller classroom spaces. We'll be restricting community use of the school division's facilities during this time. And we also want to reduce the number of visitors that are allowed in our schools during these times. We know that despite our very best efforts, it is likely that a student or staff member will be at school with COVID symptoms. So it's important that we know what we'll do in that case. Our health services staff will be on the front line of this response. They'll determine if a student seems to have COVID symptoms. If so, I'll make sure that the student has given a mask. We'll have a separate COVID isolation room in each school where a student that has COVID symptoms will stay until a family member can get to school to transport them home. This will be separate from our regular clinic. We know that we're going to need the clinic for those children who have other issues apart from COVID. It's going to be imperative for parents to realize how important it is for someone to get their child home as soon as possible. The isolation rooms will be cleaned and disinfected after use. If there is a positive case, our health services team will work with the local health department to communicate with others as soon as possible and as necessary. The current guidance on returning to school or work requires at least 3 days with no fever without the use of fever-reducing medications, and at least 10 days since symptoms first appeared. It's possible that this guidance will be updated, and if so, we'll keep everyone notified of that. Before any student can return to school in the state of Virginia, each school division is required to submit a health plan to the VDOE. The plan outlines the school division's plans for many of the topics we reviewed with you this evening. We submitted our health plan last Friday. Another question in our survey related to the need for childcare for both parents and staff. The data shows that 26% of our parents thought childcare would be a challenge, with another 14% saying that it could be a challenge for them. Less than 20% of our staff indicated that finding childcare would pose a problem for them returning to work. Since we know that it is important to some parents and staff, we've been working with the city's Department of Recreation to determine if childcare could be provided at schools both before and after school, as it normally is, as well as all day. To make this happen, we'd have to identify space in schools, which of course will be at a premium, and the city would also have to identify staff for this effort. We have been talking with them about the possibility of some Newport News public school staff being available to assist, depending on what their job requirements would look like during this time. The current child care model relies on Newport News Public Schools transportation. We do know that that's going to be limited, so we're considering that as we work on this plan. That's it for operations and safety. At this time, Dr. Parker is going to address next steps.
And thank you, Mrs. Rousseau. I will move into next steps, and which will give a further guidance as far as how we plan to take the information that's being provided this evening and move forward with a reasonable plan for returning to school in the fall. How do we get to that point? As we've mentioned, we have taken a sizable amount of time this month to review survey data, meet with organizations and groups around the state and in our community to start to forward think what would be a reasonable process for bringing instruction back to school in the fall. So we still have work to do, as we can tell, and many of our stakeholders tonight who are listening in have realized that there have been plenty of questions regarding what would happen if A happens or B. What if a person gets sick? What if we have to make adjustments because of the rate of the increase in our community spread? So those are still type of questions that we're still working through, and we are going to continue that work as we move into the closer to the fall. So there's still plenty of questions that need to be answered, and there's still information that we need to gain from our stakeholders now that you have received some information regarding our initial plans for keeping students and staff safe, and also providing instruction moving into the fall, whether it be a hybrid or a virtual option. So our next steps will give some more insight into how do we bring that process to a resolution for our board to reasonably make a decision, and I will share that with you. I will start with athletics. We recently heard from the Virginia High School League that our fall sports decision will need to be made regarding whether students will have a fall sports season this year. For those who have not tuned into that information, here are the three options that the Virginia High School League is currently considering, and they will make a decision. They're expected to make a decision on July 27th. Option one for the fall season is the fall season begins with low and moderate risk sports, such as golf and cross country, and the other fall sports activities would be canceled. Option two would be to switch the seasons, fall and spring, because some of the spring sports have a lower incidence of contact, such as track and tennis and other sports. So that's option two, is to switch fall and some of the spring sports seasons and have some of the spring sports play in the fall. Option three would be to delay all sports until December and have those sports seasons be shortened to accommodate a fall, spring, and sports season in a shorter period at the latter portion of the year. So the Virginia High School League is currently taking input and discussing those options around the Commonwealth, and they will come to a decision on July 27th on where we will be with, where we will end up with fall sports. In terms of finalizing our planning for returning to school, we still have some next steps that need to be taken. And we feel that we've collected a very good amount of information from our staff, from our parents and students initially in early July. However, now that our constituents are informed of our planning, we would like to continue to have further dialogue and receive input and feedback on our plans for returning to the fall. So I will outline that process. So this week, beginning this week, we will communicate the proposed plan will be placed on the division website with frequently asked questions as we continue to collect questions from our community and our stakeholders. Those questions will be vetted through a series of committees, academics, sports and activities, human resources, safety. So we'll continue to take those questions to smaller committees, and those committees will also involve stakeholders in some of those discussions around some of the questions that we're receiving from the community. So we encourage folks to continue to, to complete the survey that will go out that will launch this week, but also as we continue to solicit further input from communities, we will post frequently asked questions on the website and we'll launch that website this week on the Return to Learn planning. Our goal between now and August 4th is to continue to further provide information regarding our planning for the fall and to continue to collect data from our constituents. On August 4th, our school board will have a retreat on August 4th, and a special call meeting will be held to review the relevant information that we have collected on our Return to Learn plans from our community and stakeholders, and they will receive a formal recommendation at that time for our schedule for the fall. So, and I'll share the options for those selections in a moment. In that meantime, between August 4th, we'll continue to engage our community through meetings, social media, and we'll try to make sure that we continue to work through some of the dilemmas and concerns related to our fall schedule. So here are the options that we have landed on in terms of returning to instruction in the fall. 3 options on the survey will be proposed to staff and parents this week on that survey. So I encourage our constituents to complete the survey, because you will have an opportunity to provide input into which of these plans you feel best suits the needs of not only your child, but also our school division as a whole. So I will just briefly speak to each one of the options. If the one thing that is noted with all 3 options, we felt that in speaking with our colleagues from around the state, that we needed to leave a virtual option on the table for any parent who has an interest in having their child attend online home instruction for the first semester of the year. So all 3 plans will still leave that option in place, that if a parent chooses to have their child attend a virtual home instruction for the first semester, they will have that opportunity to register for online learning for the first semester. In terms of the actual plans for all students, the first option will be to begin the start of the school year, the first 9 weeks, with all students receiving 100% virtual instruction online. And that with the option of moving into either a later phase 2 or 3 plan based on conversation during the first quarter. That would allow us to eventually start to phase students into regular classes, whether it be 2-day a week or hopefully eventually a full week of classes. But we would start the school year with a virtual option for all students. Special populations of students will still receive specialized instruction as needed to meet the needs of our special education students. The second option includes a virtual instruction for nearly all students with special populations regarding our special ed students, our English language learners, and early childhood students having an option to meet face-to-face as needed. So an option could be provided if we have grades 4 through 12 completely online, 100% virtual, then those populations, special education students, English language learners, early childhood students would be able to be provided a schedule that would provide for a hybrid schedule for those students. And then the third and final option would be our phase 3 plan, which was introduced this evening, which would be a combination of a hybrid and a virtual schedule opportunity for all students, where all students would return to school in the fall with a hybrid schedule of 2 days on and 2 days of in-person instruction, 3 days virtual. Again, all 3 options allow for a parent to choose an option for 100% virtual instruction for their child. But we feel that we have to have a plan in place that, one, provides the most accommodating instructional program for our students. The one option that was taken off the table, and as we continue to collect information, was for all students to return to a full day schedule 4 or 5 days a week. Under the current mandates of 6-foot social distancing, the restrictions on our bus transportation, we were well aware that we would not be able to accommodate 100% of our students reporting to our our school buildings every day and continue to meet the safety guidelines necessary to keep staff and students safe. So these 3 options are the options that will be proposed and sent out via the survey. And we hope that we'll collect the information necessary to provide the board with a recommendation on August 4th. So our considerations moving forward are very clear. The first priority is to make sure that we have a process in place moving into the fall that will allow our staff and students to be safe under the current situations that we're dealing with the COVID crisis. We cannot look into the glass ball and see whether it will continue to get worse or whether it will get better in the coming weeks. That way that means we have to continue to monitor our current situation and our locality to see if we are in a position to keep everyone safe if we bring folks back to school. The other thing that we have to make sure that we feel very confident about is that feel very confident that we can provide virtual learning for all of our students in some degree. And with that being said, we still are working on the professional development, access to technology, a new learning management system, which will allow for consistency and quality of instruction. But we feel that the capacity of our ability to provide virtual home instruction has significantly increased since March of this year. We'll continue to monitor community spread. That will impact our decision, the recommendation that we bring forward on August 4th. We will continue to look at our operational capacity in terms of how we would serve students in either a hybrid or a virtual environment, and continue to work on the dilemmas that we've started to receive in terms of the questions we're receiving from stakeholders regarding either of those models. So we will continue to meet in committees and address those common questions that we're receiving. And the final thing is to continue to receive input from our families, our students, and our staff to make sure that the best recommendation we bring forward on August 4th reflects the will of our community and at least the voice of our students, staff, and our parents. So with that being said, Mr. Chairman, I conclude our presentation for this evening. I would like the opportunity for my staff to answer any questions that the board may have.
Thank you, Dr. Parker. Are there any questions at this time? Yes, Dr. Vest, please.
Yes, I just want to make sure I'm clear, Dr. Parker. There are three options, but one of the options is that parents have the right to do total virtual instruction. Which option would you choose if that's your option?
Yeah, yes, and yes. There are three options, unique, very different options that that our community may select on the survey. But in all three of those options, a parent still has an option to choosing online virtual instruction for the first semester of the year. So in any of those, whether we come in under option 1, option 2, or option 3, if a parent says, I want to elect to have my child receive virtual home instruction for the first semester, there will be a checklist they'll need to complete that allows us to assess their readiness to provide that quality of instruction in the home, and they would be able to have their child receive online instruction for the first semester of the year.
Okay, I just want to make sure because I need explicit instruction. So if someone asks me, so if I chose that option, what do I do? Because you said you'll get a questionnaire. Who do I tell? Because it wasn't in those three. Who do I tell?
Those are next steps. And after we receive the survey, and I think your thinking process down the line, and
Okay.
as well as myself, Dr. Best. The first step is to complete the survey, and complete the survey. We need that information to make an informed decision on August 4th. Now, once the survey is completed, my staff, we will review that information. We're also working in committee on different questions we've received as we started to develop these plans this evening and continuing to work on that. We will bring a recommendation to the board on August 4th. Now, once that decision has been made, there will be a parent election form or a registration form that will go out. So if a parent says, my choice is I want my child to choose a virtual option for the first semester, okay, it doesn't matter what option is selected, they will have that opportunity to select virtual. We didn't want to take that off the table, and talking to our colleagues from around the state, they felt that there were a lot of divisions doing a lot of different things, but it seemed that offering that opportunity for virtual home instruction seemed to be one of the better options too for parents who have significant reservations or maybe have some risk factors in their home that need to be heavily considered.
Okay, thank you.
Yes, Mr. Ely.
I would first like to say this was a very great, thorough presentation. Everybody did a great job. I know a lot of time went into putting this presentation together for us as school board members, but most importantly, the community. I had a question. We're approaching the fall and winter months, and even though we're dealing with COVID right now, we will be dealing with the common cold and the flu. How will we determine what kids have the common cold or the flu? Because I just got over, still going through this aftermath of COVID, but I'm negative now. But when I was going through COVID, I had the same symptoms if I had the common cold. I had a fever and I had the chills. So how will we determine if children have the common cold, the flu, or the COVID? And we putting them into the isolation, because studies have shown that you can get the common cold. I mean, you can have the flu and COVID at the same time. And doctors are saying they are afraid for this upcoming winter and fall, because we just finished dealing now with just mainly COVID. But how it's going to affect everybody when we're dealing with all three of them at the same time?
Mrs. Rousseau, I think I'll give you the first swing at that question. Thank you, Mr. Ely.
Hey, Dr. Parker, I'm going to take the first swing, but we do have an RN on the line here who could probably answer it more professionally. But let me start while Ms. Weber gets herself, her video started. Mr. Ely, I think the real answer to that is that what we're going to do is we're going to look at the child's symptoms. We have an RN in each of our buildings, and they'll make an assessment initially about what they think. We will not be making the decision about whether the child has COVID or not. We'll isolate them in the event that we think that they do, and then they'll be referred to their health professional to decide what really the child has. I mean, it's not really going to be our job to determine whether or not they have COVID. We won't be able to do testing. That's not something we can figure out. So what we're going to do is try to make sure everyone's as safe as possible. Our RNs are used to dealing with every type of childhood issue in their clinics. So they've seen flu and they've seen colds and they've seen every other kind of thing, many things that I've probably never seen. But anyway, I only raised 2 kids. They've got hundreds every day to deal with. So they're going to use their best professional judgment to make a decision about, is this COVID-like or not? But they're not really diagnosticians. And so that'll be left to doctors to determine once the child is returned to their parents and then taken to a health professional. So Mrs. Weber, anything you'd like to add?
I guess I would like to say, can you hear me?
Yes.
That when flu season starts, of course, physicians will have availability to test for flu, which is a much easier test to do than the COVID test is, and typically more available. So that I would surmise that any children we send home once flu season starts would, if they went to seek medical attention, that they would be tested for the flu. So that could be either determined and diagnosed, or the child could then go through other diagnostic testing. However, if you send a child home with a fever and a stuffy nose and a stomach ache, he may just have a regular cold, as you said. However, the regular cold should resolve in a certain number of days, not continue on as COVID and certainly flu may. So we'll be doing some education with families and with children also, and working on fact sheets and things that we can send home with these children as their parents come and get them, so that it gives the parents some direction as far as where to go to be seen, what signs and symptoms to be looking for.
Thank you, Ms. Weber. But just in my actual experience with this, I went to probably, because I don't play about my health. I went to every hospital around here and every mini clinic just to see what's going on. And when I first went there, one of the hospitals sent me home. I go back to another hospital the next day, I had pneumonia. So I don't think a lot of these physicians, this is all new for them. And I just would hate to take this gamble with our staff, our kids, because like I said, I've had a cold plenty of times. I had the same symptoms as a common cold, a fever and the chills. That's it. I didn't have no loss of taste. I didn't have none, I wasn't coughing. I didn't have any of those symptoms. So I just want us, as we thinking this through, I know we're saying we're doing a fact sheet, but there's really no way to know because so many people don't have no symptoms. And I'm just afraid if somebody with no symptoms have the COVID, they go home to their grandparent, give their grandparent the COVID, and then what? The grandparent may not be as strong to survive this daily disease. And even with me now, I have nerve damage in my knees. So what I've been going through and still going through, I do not want to see no child, no teacher, no adult, anybody endure this pain that I had to endure. So it's kind of personal to me. And I know when you make decisions, you don't supposed to make them personal. But this decision I'm making right now, it's dear to my heart. I just personally feel that having staff, I don't even want central office. I think they should work from home because you just don't know. Somebody could sneeze and it's in the air. Like if somebody say, how you caught it? I don't know how I caught it. You don't know. The doctors don't know. So I just want us to continue to think this through. And I know a lot of parents depend on the school system for that actual support of watching their children and getting their education. But it's just we're in trying times, and I'm just, to be honest, I'm very nervous. I'm nervous about teachers returning to school. I'm nervous about children returning to school, and I'm just thinking when I was a child, and you say all this social distancing, it's hard to tell a 4 or 5-year-old to walk this direction or walk that direction. It's hard enough to tell a child to tie his shoes. So for us to, or keep on a mask. So for us to have all these requirements for children, I think it's going to be very challenging. But I know that our staff, our central staff, it's an amazing plan. I would like to maybe this plan would be a great plan once maybe we have a vaccine and we easing our way back into it. But to just go into this now, I'm just one board member. I'm kind of nervous about it. But
all right.
Overall, it's a great plan, and everyone did a great job, and it's a thorough plan to action to improvise.
All right,
So
thank
I
you, Mr.
appreciate everybody who put this plan together. I'm not knocking the plan. It's a great plan, but just my personal experience, just having a fever of 101 and the chills, I know once we dealing with all three, and I know this from going to Riverside, from going to Centera, from going to Port Ward, that's been a concern of doctors and nurses, like, we got to get ready because we're going to be dealing with all three. People are going to be coming in the emergency room thinking they got COVID and they got the flu. They're going to be thinking they got the common cold and it's the flu. So
right.
it just concerned me for this upcoming season.
All right, thank you, Mr. Ely. Are there any other questions this time? Yes, Ms. Amon.
Thank you, and thank you to everyone for an excellent and thorough presentation, and you've addressed many of my questions as well, so thank you. A couple items or questions. So to follow up on Mr. Ely's, because we very often will not know what a student has, cold, COVID, flu, as the fall and winter gets here. Are we looking at, if you have anything in that area that could be either one of those, are we looking at more wanting students to wait 3 days before they return to school versus, I think in the past it was 24 hours fever free. So that might be something to speak to parents about. And then I guess second, different question, for those that have younger students, the hybrid model, we did talk about wanting some communal areas off limits. The younger students, a little hard to sit in a classroom all day long. What are the thoughts on recess or giving some opportunity to get some energy out and come back and refocus?
I'm going to ask Ms. Weber to take the first part of that question.
I do want to say, Mr. Ely, I'm glad you're up and about, and hopefully that people are learning a lot about this, and so we won't have individuals, adults or children, kind of going through the healthcare system and not getting the information they need so that they can take care of themselves. Experience is a good teacher. As far as, Ms. Amon, your question about fever and 3 days, we always ask when we send a child home with a fever that the child stays home for 24 hours without taking any fever reducing medicine. So if I send you home this afternoon and you've got a fever and mom wakes you up in the middle of the night and gives you some more, you're fussy and she wants you to sleep well, then you really shouldn't come back at all the next day. That's sometimes really hard for parents to do, but I think we will be encouraging people to keep their children home more than the 24 hours that is required. But, we all have different reasons and things that have to happen. So we can't refuse them entry if they meet the criteria. I do think nurses will be checking a lot more with families after children are sent home from the COVID isolation room, because we really do want to know, is there going to be follow-up with this family, or is the child getting better? And then, another phone call the next day. It's going to be a complicated time, but I think one that we have to put our effort forward towards helping families cope with this dilemma, this emergency.
With regard to your second question, Mrs. Amon, I think we could allow students, I believe, to do recess as long as we staggered classes going out for recess. And then we would have to make sure the equipment was cleaned in between use. So I think that's doable.
And we do also have activities that have been pre-planned. We did some of that in the spring semester, maintaining social distancing, and as Mary Lou said, cleaning before and after. Students may touch a ball or a hula hoop or a jump rope.
Kids do need to get out and let off some steam. We think that's useful for kids, so we want to make that happen for them.
Thank you. Any further questions? Yes, Ms. Searles Law.
Well, I also want to thank the administration and Dr. Parker with the cycles that it took to get us to this point, and to thank you in advance for the additional cycles that it's going to take to get us to the finish line and through this process. So I actually have three either comments or questions. The first one is about the capacity of virtual learning. So how will the beginning, if we do begin 100% virtual, be different than the emergency move to virtual learning that we had to ensue in March? Because I know that that should look different. And I think that will help parents in the community make these decisions a little bit more clear, knowing that. Also, is it possible maybe to allow board members the opportunity to see in-person configurations for instruction? This is all very helpful, electronically to be able to see it, but perhaps when we start setting up some of the classrooms, if we could just be invited to come through in our sneakers and jeans and just take a look, just for our knowledge as we're making some decisions here, that would be very helpful. And then the last one, which actually comes from parents in my district, they want school supply lists. Whether we are going to be in person, virtual, they would like to be able to get a head start on getting the materials such that their students are best supported in any of the environments that they're doing. So if we can, however that might be, get school supply lists out, that would be very, very much appreciated. So thank you so much for fielding my questions.
Sorry for the delay. I forgot to turn my video back on. So I will take a stab at the first part of your question to talk about how the learning will look different. And then I'm going to ask Dr. Jones to chime in and help me. From a technology perspective, we're in a much better position now. I talked to you a little bit about having Chromebooks for every student and being able to purchase a good number of hotspots so that we can really adequately support families who might not otherwise have a connection home. Because the biggest piece in virtual learning, if you can't connect, you can't engage. So we need to make sure that we have a level playing field for all of our families. And I think we did a good job of that in the emergency situation. We were able to get some stuff out quickly, but I think it will be much better now. It'll be we'll have a lot more supports in place. As far as the actual learning, I think having a learning management system, a lot of our teachers use Google Classroom, but it really was not a standardized approach. And some of the feedback that we got from families was that it was very difficult if you had several children in the school system, and particularly if they were high school students, you got 7 teachers, 3 kids, you got 21 teachers, and trying to keep track of the assignments, what to do and when it's due, and some were looking in Parent View and some families were looking in Google Classroom, and everything didn't really line up. So what Canvas gives us really is that single pane of glass where any teacher, where any district administrator, where every parent, where every student can go and see all of their classes, all of the discussion, all of the content, all of the due dates and assignments. So I think it really allows us to standardize, so it's going to look the same from class to class. Whereas Google Classroom, teachers have a lot of leeway and they do a lot of customization. In Google and Canvas, we start with the shell so that the basics of here are your assignments, here are your due dates, it's all in one place, it all looks the same. And then as for the learning, I think Dr. Jones has spoken to that and she can speak to it again, but I think the biggest difference is really going to be around expectations and the fact that we're talking about adding new learning, whereas before we were really just trying to keep the ball moving forward. So I'm going to turn it over to Dr. Jones and let her speak about the academics.
Thank you.
I think the experience of virtual teaching and learning has helped our teachers. They've engaged in professional development. They've continued with their PLC meetings, their professional learning community meetings, and they've revised the curriculum to reflect a blended environment. Before March, teachers taught traditionally face-to-face, but as we had to react in an emergency, as Mr. Jenkins said, teachers did react in an emergency mode, and many of them for the first time had to engage in technology in ways that they had not before. So we've been having professional development the entire summer. It goes right up until school starts, after school starts. and teachers are becoming more comfortable with the technology, whether it's face-to-face or in-person instruction.
Thank you.
All right, I believe that Mr. Harris had a question, then we're going to come back to Dr. Best.
You can go ahead, Dr. Best.
Thank you. I had a couple of things, but I too would like to commend the division, Dr. Parker, staff, and everyone that participated in putting this together. I know it was a lot of work. It took a lot of thought. And so you are to be commended for a job well done with a very thorough report. I have some comments and some questions kind of woven in between. I'm trying to get everything answered that I have because I have a lot of questions coming to me every day. And Mr. Ely and I were talking about it as we run across community folks. Before he got sick, there were just dozens and dozens of questions. So I want to make sure I'm asking those questions and giving out correct information. As far as, because everything is because there's so much unknown with COVID-19 and it's like a moving target, I think that transparency is of the utmost, one of the things that's needed most. So people will know that everything we know and everything we're doing, we're being open and honest about. So one of my things, I'm wondering if as far as reporting cases and involving staff and student, of course, without divulging any personal information, that will we have some type of way of keeping up with that and reporting that? I know they do that in the shipyard, but that was one of the concerns. Actually, a couple of people have asked about that. And I know you'll be coordinating with the health department probably with that as well. And regarding tracing, if a teacher or staff member comes up with that, I take it that you'll be coordinating with the health department as far as tracing is concerned. And leading right into that, when a student or staff, when students are quarantined, and I asked Dr. Parker this question, we talked about it a little bit when we had a smaller meeting, as far as liability and waivers and that type of thing. We will be upfront with the staff as to what our position is and those type of requirements. But I also asked what would happen if a staff member was asked to sit with a quarantined child. What would happen if that staff member refused? So I want the public to know we are considering, especially staff members, those kind of questions, because one of the concerns that has been voiced to me time and time again is, yes, we know you all are concerned about the students, but don't forget the staff members. So I want to assure the staff members that we're not forgetting about them, and that's why we're asking the hard questions. So those are my things.
Well, Dr. Best, I'll go and I'll give a shot at some of those. I think if Mr. Wallen, if you want to chime in on the question about COVID reporting. But during the school year, when we initially were running into cases that were becoming available at some of our schools, where we had a staff member or may have been tested or self-quarantined, I do remember very clearly that we were working with that principal to make sure that some level of communication went out to students and staff and families, especially if there was a risk of some type of connection between that individual. So we'll continue to in a transparent way, report out on individual cases. It's important that we continue to make sure that we do not give names on individuals and respect their privacy and from a legal standpoint as well. But we have communicated when we were under those circumstances, when it was necessary to make sure that the appropriate people were made informed that they may have been at risk of exposure. Those communications did go out. Regarding issues with personnel matters, I think one of the committees I mentioned that we're going to take to a smaller committee, because we get a lot of questions that come in regarding all the circumstances regarding returning to instruction in the fall. Some are personnel related that deal directly with our contractual obligations on employees. So we will form a smaller committee that will obviously engage with our staff too, to make sure that we work through some of these items and develop FAQ question responses around those specific questions. There are going to be plenty of circumstances that we need to kind of just vet through, not only from a legal standpoint, and that was the recommendation from the Virginia Department of Education, that as we move into our instructional plans for the fall, make sure we continue to vet those plans, not only through our legal assistance, but also through our risk management professionals to make sure that whatever we choose to do, we're making the best decisions possible to minimize risk to employees or students. So with that being said, those type of questions, a very good question, we need to sit down with our risk management team and our legal team to make sure that we're making the best decision possible around every dilemma in every circumstance.
And one other circumstance to consider is reporting. Again, teachers and their family members are very concerned, about their loved ones. And you all probably have talked about this, but maybe, I know you couldn't touch on everything today, but if there are some things in place, and if there are some administrators or staff members that are not following safety procedures, there will be something in place, correct, as to how to address that, how to report it, and that type of thing. Correct?
Very good example of a personnel question that we would want to make sure we vet and have a process for. Okay. Yes, ma'am.
Thank you.
Thank you, Dr. Best. Mr. Hunter.
Thank you, Mr. Chairman. I had received several questions from parents, and in particular, will there be any modifications to the grading scales or protocols with any of the three models that were discussed today? A lot of folks, especially the senior parents, want to know how the kids are going to be graded. They were graded a lot different last semester. And so that's been on a lot of the individuals' minds about how grading will be, how attendance will be taken, and those types of things.
Well, that's a good question, and Dr. Jones, you can chime in if I miss anything. The first thing we need to be reminded of is currently the Virginia Department of Education is still looking at what will be our required reporting next year in terms of accreditation, chronic absenteeism, what waivers will be in place in terms of testing and assessments. But we still have a requirement to take daily attendance under Virginia, under Commonwealth law. So we're required to hold a daily instructional day, and we have to take attendance for students of record. And the difference between last spring and this upcoming fall is that in the spring we were under a more of a crisis circumstance where schools were canceled on the drop of a dime, and we had to put a continuity of learning plan in place that allowed us to provide home instruction for students and to determine a final grade without penalizing students for things like missed assignments or work over that period of time, but to make sure that we were still engaging our students in some relevant instruction that would allow us to determine a final grade. This will be an instructional year, so attendance will be taken for classes. Students will have assignments that they will. Oh, wow. Was I just continuing on without speaking? Okay. So I'm sorry, Gary, I was on mute. Somebody needs to pop me if I'm talking on mute. So Mr. Hunter, I'm going to have to do that again. So one of the things we're reminded of is that the Virginia Department of Education has not fully given out all the standards necessary as far as school accreditation for the year, standards on chronic absenteeism, what assessments we will need to provide students. All of those things are still being worked out for the upcoming year. What we do know is that we're required by state code to take daily attendance. And we also have requirements for instruction in terms of students to receive credits towards graduation. So the difference between the spring and the fall will be that under circumstances in the spring, we were in more of a crisis situation that required us to provide ongoing continuity of learning that would enable us to provide home instruction for students that would allow us to determine a final grade. Now, with that being said, at some levels of instruction, we were just remediating students on previously taught material, and there was not daily attendance taken. Students were given online assignments, synchronous instruction at the secondary level, but some students, like at elementary, just had packets, and they did not necessarily meet with their teacher on a day-to-day basis. That will be different in the fall. In the fall, it will be a normal instructional day. Attendance will be taken. Students will have grades assigned. There will be a course expectations, and students will need to turn in those assignments and receive quarterly grades like they normally would during a regular school year. very different students who are chiming in. This will be a regular school year. So with that being said, students will be absent. Students will, there will be attendance related contact if students are not meeting their class requirements or turning in their assignments. So grades will be determined normally. We do not have any plans at this time to make any modifications to the grading scale, to our grading scales based on classroom instruction and assignments. We do understand the circumstances that there may be warrant some consideration depending on home circumstances, but that will be handled from a support basis. But our expectation is that all students will be involved with some form of instruction every day, and classes will meet on time, attendance will be taken, and instruction will be given for a set period during that student schedule.
And Mr. Hunter, while we're not revising the grading policy, we are revising our grading plan to have more continuity between teaching, assessment, and grading. So we have several teachers, K through 12, who are actually working to revise some of our grading practices, because they are some lessons that we learned from the spring, and we want to improve and be more consistent across the division with our grading and assessment practices.
Well, thank you. Thank you for that answer. I know that's on a lot of parents' minds about this grading.
All right. Thank you. And I believe we have a question from Mr. Harris.
Thank you, Mr. Chairman. Not so much as just a statement, but I appreciate the briefing tonight, Dr. Parker and your staff. Mr. Chairman, I just want to make sure that we make sure that we maintain vigilance on this situation because this is asymmetric, what has happened to with this virus. And so as a school division, we also have to think asymmetric, which means there is 1 + 1 will not equals 2 in this situation. And I think as long as we maintain flexibility, and this is a time where coordinating with your left and right supports outside of the school division is going to be imperative. This is a time for us to ensure that we have strong ties with the city and with other stakeholders, because this is the only way that we can be successful during this transition. So just don't want to lose focus on that. And there are some lessons learned in the past when dealing with I call it a crisis because we don't know origin nor who's next. So just as long as we're maintaining a vigilance and coordinating with individuals that has interest in us supporting our students and staff and our families. Also, how much flexibility, and this is for Dr. Parker, how much flexibility is built into the parents if the family dynamic change after we start school? So 2 months from now, something happens and that family has to go to another set of instruction versus probably what they wanted to. Is that, do they have flexibility in that?
Well, that's one of the things we'll be working through, Mr. Harris. It really involves it's a scheduling question,
right.
Pretty much what you're asking it. And as you're aware, virtually we can definitely offer a teacher to teach a full case class size and load. But if we move to courses being taught face to face, there is a limited number of students who can be in a particular section. And that might be a space availability issue. So and we will be very clear and to parents as they make their selections for the fall, that if they choose an online virtual option, that space availability may dictate whether they are able to transition their student back to a face-to-face option. Under those circumstances, in particular with the first semester. So the answer to that question is we'll make every opportunity available to make sure we put the student in the best position to be successful. That's number one. And if we can't accommodate a transition from whether it's face-to-face to virtual or virtual to face-to-face, then we'll provide the supports necessary for that student to be successful. So our number one goal is to meet the student where they are.
All right, thank you. That's it, Mr. Chairman. Thank you.
All right. Thank you. So a really very detailed report. Thank you Dr. Parker and your staff for preparing such a wonderful and detailed report for the board tonight. I think the take home for everyone is to remember that tomorrow the survey starts. So July the 21st, the survey will start, and that is your opportunity there to weigh in on the options and how you feel about each of the options that were presented here tonight. So please check our website, and please as well listen to your emails and look at your phone messages that will come out. There will be announcements that will come out about the survey, and there'll be opportunity for the community to involve themselves in the survey prior to the board taking our final actions on August the 4th. All right. At this time now, I'd like to move to comments. Item 3.0, comments by the superintendent. Dr. Parker.
Well, first I want to say thank you to our staff for the hard work that they've put in over the past weeks to try to collect enough information to meet with colleagues from around the state and within our division to try to maneuver some of the guidelines that are ever changing. As Mr. Harris mentioned, we're in an ever changing environment, and to pull together some relative options that we feel we can accommodate for fall instruction. Now we're going to turn that responsibility back over to our staff and to our community to give us some additional, now that you've been informed on our the data and the information we've collected and the proposed plans that are being put forward. We need to hear from you, and we also need to continue to engage and dialogue with you to ensure that we're making the best decision possible for our students and staff. Safety of our staff. I'm a staff member, so the safety of myself and my family is at the utmost, from a personal standpoint, is very important. The safety of my colleagues here is very important. So I would not expect anything less for anyone at home this evening listening in who is weighing not only the risk factors associated with their own personal health, but the safety of their families as well. So we take that very seriously. We're going to continue to monitor the local COVID community spread to make sure that hopefully we'll see a positive trend in the upcoming weeks. But I can assure you that your voices are being heard as you continue to engage with us, and we'll continue to work through some of the questions that we're receiving. We had no expectation of coming here this evening with every question answered. I think on one email alone, I've received a link to almost 300 questions. So with that being said, there's still a lot of work to do. But I can assure you, we want to engage our teachers and our students and our staff and our community moving forward to make those decisions. I had a good meeting with Mr. Carlton Ashby, who's a former board member. We met electronically early last week, and I had a good conversation. And one thing Mr. Ashby said to me that stuck out as he looked at the dilemmas that this board is going through, he wished you all well. He said that one thing we have to realize is that there's two things that are different between perfection and excellence. And Carlton said that perfection is God's business. If you know Carlton, he's going to make a reference to his religious background. Perfection is God's business, but it's our responsibility to make sure that we make the best effort to strive for excellence. And that stands with me. I don't think we'll be perfect in the decisions that we have moving forward, but I can assure you that we're going to continue to make the best decisions possible to achieve some level of excellence for our staff and for our students. And with that being said, Mr. Chairman, I will yield any of my time for any board member comments. Thank you.
Thank you, Dr. Parker. All right, now we come to comments by the school board members, and Mr. Moody, as our student representative, we'll let you go first tonight.
Well, thank you so much, Mr. Chairman. Good evening. I have a few things to share while we are living in such unprecedented times. Great things are still coming from NMPS, and I want to share just a few of those with you. This summer, from June 24th to July 15th, the NMPS Rise Empowerment Network hosted the Boys Read 2 summer reading program. This was led by Dr. Darren Ford. During this program, Mr. Antoine Bethea, NFL player, Mr. Tommy Riemann, entrepreneur, Mr. Vernon Woodard, elementary educator, and Councilman Dr. Marcellus L. Harris served as guest facilitators. What a fantastic program. Secondly, I am super excited to introduce to you the Vibe Student Talk Show. Tomorrow, the Vibe will release their second of many Tuesday talks. Each Tuesday, you will hear from a reporter of the Vibe on today's hot topics. You can check it out tomorrow at 3 p.m. Big shout out to NMPS graduates Brandon Hedgepath, Michael McLennan, and Vontrez Moore for your dedication and support of this project. I am super excited for the Vibe's future. If you are an NMPS student and you are interested in being a part of the Vibe, please email thevibe@nn.k12.va.us. And lastly, I invite students, parents, and staff to connect with me virtually through Facebook, Instagram, and Twitter. I hold the digital hashtag on all of those sites at StudentRepNMPS. Again, at StudentRepNMPS. Thank you so much and have a fantastic evening.
Wonderful. Thank you, Mr. Moody. So Mr. Moody has set the bar exceptionally high. Ms. Amon, now it falls to you.
Okay, well, I just want to reiterate what I said. I want to extend a big thank you to Dr. Parker and his team for going through all of this. And thank you for being, for accepting many of my questions. Hopefully, I don't think I was the 300 question email, but but thank you for, you've been great about taking them and getting back to me, adding them to what you guys are considering and working through. So I think it's good. I am very encouraged that we are getting a device into every child's hands and we'll be getting everyone online. I think as much as we can plan for children being in school, and that's great, and that's what we want to strive for, we could be looking at this a month or two down the road with many numbers at home quarantining or sick, or numbers change. So to be ready to switch for any child or group of children or the system, as we may need to go virtual here and there, I think that's really excellent, and I'm looking forward to seeing how this year goes. There might not be too many snow days for kids to not tune into learning, but we won't be losing learning on those days either. So I just want to commend you guys for everything that's been done, and look forward to hearing the feedback in the next week or two. And firmly believe we're going to get to an even more refined approach that will hopefully serve us well this year.
Thank you, Ms. Amon. All right, Dr. Best.
Okay, I'll be very short. I'd like to welcome Mr. Moody and Ms. Amon. Welcome on board. Also, again, I would like to thank Dr. Parker and staff for a very thorough report. I'd like for the parents, the teachers, community members, clergy members, former educators, current educators, NNEA members, and Johnny on the street to know that we hear you. We hear you, and we're taking into consideration your input. So please walk away with knowing that we hear you. Thank you.
All right. Thank you, Dr. Best. And now, Mr. Ely.
Thank you. Once again, I would like to thank the staff. It was an amazing presentation. Y'all did very good putting it together. It was very informative. And I know I was a little bit passionate about when I was speaking. I was just speaking, off of personal experience, and it's so dear to me. I don't want anybody to go through what I went through, and I totally understand going to school virtual is hard. I wouldn't have been the student that wanted to go to school virtually. I was the student. I was the socialite, most popular, most likely to see. I was that student who got all those awards in the yearbook. But it's just health comes first with me, and I just want to make sure everybody is healthy and we make the best decision for not just teachers, but for our students of Newport News. Thank you.
Thank you, Mr. Ely. Mr. Harris.
No comments, Mr. Chairman. Thank you.
All right. Thank you, Mr. Harris. Mr. Hunter.
Thank you, Mr. Chairman. I just have a question for, again, our school division to consider. I'm getting all these emails on my phone. I guess that's the advantage of being at home and not sitting where you are. But they've been asking me about the procedures are going to be the same for our substitute teachers, and how will we know our substitute teachers are not going to various different schools having the COVID and spreading the COVID around. So maybe if the substitute teachers are going to be assigned to a particular school, that again may help, demise this spread of this COVID. But I'm going to just say that's something food for thought that we can think about. Again, the report was phenomenal as always. Again, I asked the parents and all those folks who are out there. I have two educators here in my house, and I have an underlying disease, a condition. So I'm like you, John. I very worried about us sending kids back to school, but I know the best place for kids to learn is inside the classrooms. So, my idea was to bring all the kids back, but if the conditions don't allow for that, then we must take other steps. And I think the school system have laid out 3 plans for us to do that and have given the parents an opportunity. So as I always say, great things are happening in Newport News Public Schools. And then we look forward to parents and teachers and all those out there, please, 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 please go and fill out the survey. We absolutely must hear from you now. So, Mr. Chairman, I will give it back to you.
Thank you, Mr. Hunter. Vice Chair Searles Law.
Thank you, Mr. Chairman. I just want to say thank you to Dr. Parker and the administration. As I mentioned before, we greatly appreciate all of your hard work at this. One thing that COVID has done for us is called us to task. And I must say, I am happy to be part of a team that is rising to that occasion. I appreciate the fact that we reach out to the community, that we ask questions, we present a model, we ask more questions. So I am without a doubt, believing that we're going to answer this in the best way possible for all of our families and for our teachers. So thank you. Thank you for the time you're putting in. Back to you, Mr. Chairman.
All right. Thank you, Ms. Searles Law. Well, I want to welcome Mr. Moody and welcome Ms. Amon. It's great to have you as additions on the board, and we look forward to a fantastic year with you. This is an auspicious time to open up our school year. We're doing it on auspicious occasions, but I do believe this is going to be one of our finest hours in terms of how Newport News is handling the situation and our response. We could clearly see tonight infections are on the rise. And that is a reality of our situation at this time. And what I aspire to, and hope that I believe the board aspires with us, is flexibility to accommodate for infections being on the rise or the curve flattening. So the ability to have options for when the curve flattens, as we know that it eventually will, and for increases in infections as we're experiencing now. I want to thank the community so much. That 13,000 respondents to our original survey that started in July. As we have said before, we're in the middle of this conversation. We began this conversation in July, and I want to thank the overwhelming response. In my time on the board, that is the most respondents we've ever had. And I implore the community, let's see if we can break that record in this second middle portion of the conversation, because it's going to matter a lot to the amount of adjustments and our ability to fine tune the plan that we do have. That the board is going to look at if we can get your responses. So please do take advantage of the survey. All the folks that I know you've emailed me already, please go and do the survey too. So the folks who have emailed me, I've emailed you and told you, please take the survey. And to all the folks who made board comments this evening and the various people around who are asking questions, please take the time to respond to the survey. And what our original survey told us when we started this conversation in the beginning of July was that by and large, you, the community, what you wanted is a hybrid model, and you wanted to be able to come to school on the bus. And so if that position has changed, or if you'd like to ratify that position further, please let us know. So this is the opportunity to let us know that now. I think that we saw a plan that is extremely flexible and highly customizable, semi-customizable to families in the area. And I think that's something to be proud of in terms of the work that has already been done. Every option has the ability to do all virtual learning for any family that doesn't feel comfortable or feel safe. They have the ability to go to a completely virtual option. So that's something to really take away. Every child will have a computer. that's something for the first time in our history of our division. That is a significant accomplishment, something we've been working towards, I believe, in our technology implementation or technology plan for many years, which is a great achievement. Every child will have access to a computer, and every child will be able to receive a hotspot who needs a hotspot, so that every child will have the ability to get online and to be able to do their education online. Those are great features as well. Kids are going to get breakfast and lunch, whether they're online or they're in school. They're going to be able to still get breakfast and lunch from our schools. So those are really great features that we've already brought forward in the plan that you've seen here tonight. And we look to continue to increase the number of features, and we're sure that at the end of this, there's going to be a plan that we're all proud of. As many of you have asked about, and we heard tonight about sports and activities, I have received several questions and inquiries about sports and activities. Now we've heard tonight, and I'll reiterate again, the Virginia High School Sports League is going to be making their decision on July 27th. And so as they make that decision, we'll be able to incorporate that into the plans. And I'm confident that we'll be able to see decisions around sports and activities when we meet on August the 4th. We'll be able to hear the beginning options of the sports and activities. And then, as well as was mentioned tonight, we are taking advantage of our ability to partner with City Council. They have already invited us to present our plan so that they can get awareness and understanding and be able to talk to the community about the plan. And we're going to be taking advantage of that opportunity to present the plan to City Council as well. So a lot of really good work, and I believe a strong plan has been introduced tonight, and we'll continue to get our pencils out and fine tune it, and we'll be, I believe, putting forward a great plan come August 4th for the start of the school year. And so with that, I will conclude our regular school board meeting for this evening, but I believe that Vice Chair Searles-Law, there is a motion to go into closed session at this time.
Yes, Mr. Chairman, we have a motion for a closed meeting. The school board may convene a closed session pursuant to section 2.2-3711A of the Code of Virginia, subsection 1, for the purpose of considering prospective candidates for employment, assignment, appointment, or promotion, and discussing the performance of a specific public officer.
Thank you. There's a motion. Is there a second?
Second.
The motion has been seconded. Is there any discussion? All right, there being none, Ms. Buffalo, would you please call the roll?
Mr. Harris?
Morgan Harris, 4.
Mr. Hunter?
Gary Hunter, 4.
Mrs. Searles-Law?
Lisa Searles-Law, 4.
Dr. Best?
Terry Best, 4.
Mrs. Amon?
Rebecca Amon, 4.
Mr. Brown?
Douglas Brown, 4.
Mr. Ely?
John Ely, 4.
Motion carries 7-0.
All right, so at this time, we will exit this particular Zoom meeting and go into our closed session Zoom meeting, which should be in your emails. And so I will see all of you in about 2 minutes.
We're almost done.
Yeah, exactly. We're almost done. All right. Well, welcome back. We are now going to certify our closed session. So I believe, Madam Vice Chair, you have a motion for us.
Yes, a certification of closed session, whereas the school board of the city of Newport News has convened a closed meeting on this date pursuant to an affirmative recorded vote in accordance with the provisions of the Virginia Freedom of Information Act. And whereas section 2.2-3712D of the Code of Virginia requires a certification by this school board that such closed meeting was conducted in conformity with Virginia law. Now, therefore, be it resolved that the Newport News School Board hereby certifies that, to the best of each member's knowledge, 1, the only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the closed meeting to which this certification applies, and 2, only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered.
Thank you. You heard the motion. Is there a second for the motion?
A second.
Motion seconded. All right. Is there any discussion? There being none, Madam Clerk, will you call the roll, please?
Mr. Harris,
Marvin Harris, 4.
Mr. Hunter,
Gary Hunter, 4.
Mrs. Searles Law,
Lisa Searles Law, 4.
Dr. Best,
Carrie Best, 4.
Mrs. Amon,
Rebecca Amon, 4.
Mr. Brown,
Douglas Brown, 4.
Mr. Ely.
John Ely, 4.
Motion carries 7-0.
Okay, with that, we will then stand adjourned. Our next meeting will be August the 4th. Please remember, we do need, okay, so we do need a motion, I believe, for our personnel actions that were discussed. Is there a motion for the personnel actions?
A move for approval of the individuals that are appointed.
All right.
Second.
Thank you. Motion's been seconded. Any discussion? Okay, Madam Clerk, would you please call the roll?
Mr. Harris,
Marvin Harris, 4.
Mr. Hunter,
Gary Hunter, 4.
Mrs. Searles Law,
Lisa Searles Law, 4.
Dr. Best,
Carrie Best, 4.
Mrs. Amon,
Rebecca Amon, 4.
Mr. Brown,
Douglas Brown, 4.
Mr. Ely.
John Ely, 4.
Motion carries 7-0.
Okay, now then I will pronounce us to be adjourned. Next school board meeting will be August the 4th. And yes, it's congratulations to the individuals that were named. Dr. Parker, who are those individuals?
Thank you, Mr. Chairman, and thank you for the opportunity to bring these two fine candidates forward this evening for appointment. At this evening's closed meeting, we discussed the appointment of Dr. Tina Manglamott as our new Chief Academic Officer for Newport News Public Schools. Mrs. Manglamott is a Newport News resident. She has a 22-year teaching career and was an education technology facilitator and assessment compliance coordinator with York County Public Schools. From there, Ms. Manglamott went to Isle of Wight County as the coordinator of K-12 math, science, and technology, and she is currently in their position as the Virginia Department of Education Director of STEM Education and Innovation. During her time in the VDOE, Dr. Manglamott served as an interim assistant superintendent for the Commonwealth for Learning and Innovation. In addition, she has worked for many years as an adjunct faculty member with both Virginia Commonwealth University and the College of William and Mary. We look forward to Dr. Manglamott's leadership coming to Newport News Public Schools, again as the Chief Academic Officer. And this evening's other appointment was Mrs. Tanya Graham Galatro, the new assistant principal at Heritage High School. Ms. Galatro began her career 15 years. I'll make sure I have the right name. Okay. She began her teaching career 15 years ago in Newport News Public Schools as an English teacher. And she served the students of Dozier Middle School and Crittenton Middle School. So welcome back to Newport News Public Schools. Ms. Graham Galatro then moved to Williamsburg, James City County as an English curriculum chair at Jamestown High School, and she currently serves as the student advancement coach at James Blair Middle School. So Mrs. Graham Galatro will be rejoining our Newport News team as an assistant principal at Heritage High School. And those will conclude are the appointments for this evening, Mr. Chairman.
Thank you, Dr. Parker. Wonderful appointments, and so we will now call the meeting adjourned.